Good morning, Beau. We are live out on the internet.
Good morning.
Good morning. How are you, Maggie?
Why?
I can't hear you, Beau. Am I doing something wrong?
I can't hear you either.
All right, good morning, everybody.
Good morning.
Lovely to see everyone today, as hopefully many of us are probably getting ready for Pesach, getting ready for Passover. I suppose the silver lining of the coronavirus cloud is that there's just less food to cook with less people at the Seder. I spoke to a 90-year-old woman the other day who said to me, "Rabbi, what do I do? I've been making matzah balls for a month already. My freezer, I have 85 matzah balls in the freezer. What do I do?" And I said, "Well, you're probably having matzah ball soup for Thanksgiving." So on that note, Passover is most certainly coming. And many of us know, Jews and not, Passover celebrates and recalls what is, I think, an incredibly iconic story, certainly for Jews, but not for Jews alone. This story of Egyptian bondage, Pharaoh and Moses, in an incredibly dramatic exchange that gets played out, plague after plague after plague. We'll just leave any plague jokes or ironies that could be made right now, I think, to the side. Ultimately, the Israelites are freed, they escape, they get to the Red Sea in a miraculous scene, right? The waters part and they safely make it to the other side. And in thinking about the Passover story and the conversation we're going to have this morning, I think it has two things really to teach us in this era of coronavirus. The first is that we are commanded, bechol dor vador, that in every generation we are not just instructed to retell this story of the Exodus as we sit around our Seder tables tomorrow night. Not just retell it as this story that happened thousands of years ago to our ancestors, but we are meant to see ourselves as if it were us that were slaves in the land of Egypt, as if it were us who were freed by a mighty hand, as the story goes, as if it were us, because it is about us. And I think it reminds us that in that same vein, many of us may know that the Hebrew word for Egypt is Mitzrayim, and it comes from the Hebrew word tsar, which means narrow and tight, difficult places. So the Hebrew of it says that Egypt and that bondage is about being in a tight, difficult, and narrow place. And while perhaps, we were not ourselves actually slaves in Egypt, we all do know what it is like to be in tight places, in narrow and difficult and challenging places. Many of us feel that way now, some of us more so than others. But I think it reminds us that, Judaism takes the long view, and that we have been here before. We have been in difficult, tight places before, and come through it. And we will come through this too. The other thing that I think about when I think about Pesach, in the midst of all of this and in the midst of our conversation today, is this idea that there are really two kinds of freedom. There is freedom from something, and then there is the freedom to do something. Right? There's the freedom from Egypt in the case of the Passover story, freedom from slavery, freedom from oppression, from poverty, from hunger, from disease. Those are all very important, but they're also a passive kind of freedom. The second kind of freedom, the freedom to make choices. In the case of the Passover story, ultimately it's the freedom to accept the Torah. In 7 weeks, we'll celebrate the holiday of Shavuot, right, which is the Israelites at Mount Sinai using their new freedom to make the decision to accept the Torah. Right? The freedom to comfort others, to feed others, to help others, to liberate those who are still in bondage and still oppressed, to bring justice to the world. That's an active kind of freedom. That's a kind of freedom that can only be exercised once you have that freedom from. So freedom from something is really just the beginning if it doesn't evolve into using that freedom and transforming that freedom into a freedom to do something active, taking an active step. And that, I think, for purposes of our conversation this morning, is where Beit Tzedek comes in. Because Beit Tzedek works each and every day to make the world a more just place. And that really is something that can only happen if we're using our freedom to be able to try to free those and free those who do not have all the blessings and privileges of access that many of us do. So I'm delighted to have our guest this morning, my good friend Diego Cartagena, who I was thinking about this, Diego. Diego and I met about 10, maybe almost 11 years ago when he was in a different position at Beit Tzedek. I think back then you were still the director of pro bono programs. And I had just started to imagine what the Karsh Center might look like one day. And the very first thing that we thought about wanting to do at the Karsh Center was to use attorneys, since we have a few of them wandering around the temple, to try to make the world a better place. And the very first legal clinic that we ever tried to get off the ground, and arguably the most successful one, was with Beit Tzedek. And I remember sitting in the office with my good friend David Lash, who used to have the job that is now Diego's many years ago, and cooking up a pro bono legal clinic where we got together with Beit Tzedek and sourced clients from their Holocaust reparations work, and spent a long, lengthy day with about 20 of our volunteer attorneys preparing advanced medical directives and statutory wills for those folks. And it was a beautifully inspiring day. I mean, simply put, Diego made it all happen. And, we've had the blessing and privilege of working together ever since. I do not hold against him the fact that he holds multiple degrees from UCLA and not USC, like your well-educated rabbi does. So we are friends in spite of that. Delighted that he recently has taken over the reins at Beit Tzedek as the president and CEO, I think is the right official title. And I could not be happier for him and could not be happier for Beit Tzedek. And I'm thrilled to have him with us today to talk a little bit about Beit Tzedek and all that they're doing in the midst of our changing times. So let me see if I can unmute you. There you go. You're unmuted. Perfect. So Diego, let's maybe start there. I know a lot of us are familiar with Beit Tzedek, but some of us maybe less so than others. Can you give us like just the Google Earth view sort of kind of, what Beit Tzedek is and what happens there on a daily basis?
Sure. And first of all, let me thank you for this invitation. This is really wonderful. You saw me furiously taking notes because I think your introduction really speaks volumes to the context for which under which Beit Tzedek exists and the work that we do. So Beit Tzedek is a nonprofit legal services organization that was formed a little over 45 years ago by a group of volunteers, some of them lawyers, some of them rabbis, who looked around their community and realized that there were people in need, individuals who were, for example, facing eviction and could not afford to hire their own attorney. It also included Holocaust survivors who needed help applying for reparations payments. And so what these individuals did is they got together once a week. They would chip in their own money to rent some storefront space. They would open the doors and they would help whoever came in. If you fast forward to today, we are now an organization of well over 85 individuals. We're getting very close to that 90 employee mark. And I think by the end of the year, we'll be at well over actually 100 employees. And of those employees, about 50 or so are full-time staff attorneys. The rest of the staff is comprised of paralegals, support staff, HR, finance, and our development team. Because we are a nonprofit, we do not charge a single penny from any of our clients. to provide the legal services that we engage in. So what are those legal services? We've expanded the work from when we first started. We still do a great deal of work in the housing space. So we are very involved right now in a lot of activities and partnerships with homeless shelters and other social service agencies to prevent people from becoming homeless by representing them in their eviction matters, as well as working with homeless individuals to knock down any barriers to their ability to gain housing. For example, helping individuals deal with tickets and warrants and things of that sort. We are still working with Holocaust survivors. We've expanded the scope of that work. We continue to assist them with securing reparations payments from various entities and foreign governments. But in addition to that, we have expanded our work to include what we call elder law services. So making sure that every single survivor has access to the US federal public benefits that they're entitled to, state public benefits, making sure that their housing is stable. So if any survivor is facing an eviction, we will help them with that case. And also assisting to make sure that they all have advanced healthcare directives, and we're addressing any other issues that they may be facing. Our Holocaust survivors work taught us a great deal over the years about working with an older population. And out of that grew a larger elder justice initiative. It's one of the areas of law that we're best known for in Los Angeles, because we're actually the only legal services organization that has a dedicated elder law unit. And what that team focuses on is a lot of elder abuse prevention work. We have a team member, for example, who goes out into the community and provides elder abuse prevention presentations. Right now, she's really focused on a lot of presentations that deal with scams to make sure that seniors aren't being taken advantage of. We also represent seniors in securing elder abuse restraining orders. A lot of people don't know about some of our other areas of practice that include, for example, a tax program. We help individuals who have what's called a tax controversy in front of the IRS or State Franchise Tax Board. We help small business owners understand their rights and address issues such as helping them negotiate a renewal for their lease. We have an employment rights program that helps low-wage workers make sure that they are receiving all the wages that they're entitled to. A lot of people don't realize this, but sadly, Los Angeles is the wage theft capital of the US. The wage theft here in LA is in the billions of dollars every month. So we're doing our best to combat that. We also have a transgender medical legal partnership where we help members of the transgender community with some of their legal issues. And then we have an outreach team that goes out into different parts of our community to provide on-site advice and counsel to various community members. And that's how we developed our partnership with Karsh. We are part of the Ezra network, and we visit about 25 different senior centers across LA County.
Wow.
It's a lot.
And it's funny because when you first said that you're hovering just below the 90 employee mark, I thought, wow, that's really a lot of folks. And, you know, I guess it's not new offices anymore since you guys are neighbors of ours in Koreatown, but, you know, it's the better part of a floor in an office building. But then when you talk about how much you're doing, it almost seems shocking that you can do all that with just 85 people.
Yeah, you know, it's all part of that hardworking staff. They're very innovative in the way that they do their work. Some of the work that we do is in the form of clinics. And you saw this, you referenced it in the form of our Advanced Healthcare Directives Clinic, where in one morning, we bring in groups of individuals to help them with their legal issues right there on the spot. The other factor that's key to that is our volunteer base. We rely heavily on volunteers. It's part of our DNA. It's how the organization started. And so we have one staff member that's dedicated full-time to working with all of the law firms and in-house corporate counsel at various companies across Southern California who donate their time helping represent our clients. as well as our in-house volunteers. We have another staff member that's just focused on that, who works with college students, law students, retired attorneys, social workers, teachers, who actually come into our office and volunteer on a regular basis. So every year we receive the equivalent of, I believe it's $5 million worth of volunteer time from community members.
That's unbelievable.
Yeah, we really couldn't do it without them.
And well, so thinking about that pool of talented, dedicated volunteers who come to the office to see clients, who come to clinics to see clients, thinking about those clients who come to be served. So how has this crisis that we are in the midst of now, changed that, impacted that? I'm imagining that, since we're all adjusting to this new world of staring at a screen all day long, that you're seeing clients virtually or on the phone and not in person. But how has that just impacted the service delivery model?
Yeah, so essentially what every single team has had to do is figure out how to create a virtual model of their legal advocacy. So in some instances, it has meant calling our clients and just continuing our relationship over the phone, updating them as to their court hearings, giving them the good news that all court hearings have been continued to a date down the road because the court is closed except for emergency circumstances, and just working remotely in that fashion. In other instances, we've had to create what we are calling virtual clinics. So for example, our employment rights team, what they used to do was once a month, they would hold an actual physical clinic at our office. It was Wednesday afternoon. People would come in, ask their questions, and receive legal advice right then and there. We obviously are not promoting in-person activity. And so what we had to do was figure out how to take that to the cloud. And we've set up this whole system where individuals can call in, get connected to an attorney or one of our volunteers, ask their questions, and initiate the process that way. I will say some of the logistics have been very difficult. We've had to work through many roadblocks with clinics that we had, for example, at the downtown courthouse. We used to have a clinic there. We're no longer allowed into the courthouse, so we had to figure out how we can hold that elsewhere.
I also imagine that, we're all relying on technology so much now to be able to pivot and change the way we deliver services to folks. I imagine that some of the clients or potential clients that Beau Tzedek might be serving don't have access to the same kinds of technology that we take for granted, that we walk around with the internet in our pocket or can sit in front of a Zoom. Has that posed a challenge or a problem?
It has posed a problem, and I would say primarily with our older clients, those that may not have access to the technology, or even if they do have access to a smartphone, they just don't have that level of comfort with it. And so working with, for example, our Holocaust services team, what they have had to do is really rely on family members and be on the phone for longer periods of time than they used to be to help survivors, help walk them through their reparations application, ask any follow-up questions, make sure all the details are correct. We are also mailing a lot of documents to them and their family members so they can review on their own and send any corrections back to us. So overall, it sometimes stretches out the length of the advocacy. I don't say case because they're not all cases. I like to say the length of the advocacy, but all in all, we're still getting the work done. It just requires a lot of managing expectations and being very patient with each other as colleagues and with our clients to make sure that they still feel safe, that they still feel that they're in good hands, and that they understand what end goal we're all working towards.
So that sort of sounds like it's the current or typical client pool, and that's how they're being served and the challenges they may or may not be facing in accessing services. Are you seeing any changes to, or any evolution to, who the typical client is, right? Are there new clients coming in for different kinds of things
Yeah, yeah. So what we are seeing, and it tracks what other legal services organizations are seeing, because we all get together, the executive directors of various organizations, we get together once a week to kind of share notes and experiences. And what we all initially saw was a dip in the request for services, which makes sense, right? People were, first of all, worried about the pandemic and what does it mean, and how do we stay healthy? And then people started to worry about, well, am I going to be able to keep my job? How do I put food on the table? Rent is due, et cetera. And so we are expecting that this week and the coming weeks will be an uptick in the request for services. The exception to that experience thus far, at least for us, has been first and foremost our employment rights team. When everything hit and we saw the massive spike in unemployment, we saw numbers like in 1 week, unemployment insurance claims rose by, there were like 3 million total or something crazy like that. We started as one of the only legal services providers in LA that has an employment rights team and a team that is able to help undocumented individuals, because there are other agencies that may be able to provide this assistance, but because they receive federal funding, they are barred from representing undocumented individuals. I'm very proud to say that Tzedek's board of directors, something like 25 years ago, when we were approached with that funding, they said, no, that is contrary to our beliefs, contrary to our goals, and we will not accept that money. Instead, they worked harder to find funding elsewhere. So we were inundated with phone calls from individuals asking for assistance on, can I apply for unemployment insurance? If I can't apply, what other recourse do I have? What are these new sick time rules under the CARES Act from the federal government? It sounds like I have additional days when I can take sick time or be home with my kids. So
Oh,
completely retool their work so that not only is it virtual, but now they are answering these questions.
who is it?
And I would say the other area where we saw a huge uptick was in our small
I'm in
business.
the middle of a class. I'll give you over tomorrow.
And in our small business development work, what we saw is a number of businesses calling us, asking us questions like, I have a brick and mortar presence in X part of Los Angeles. I've heard that the mayor is thinking about or will carry out a moratorium on commercial evictions. What does that mean? Do I still have to pay my rent? How do these new employment laws apply to me? I have 6 or 7 employees. And we think that the other tidal wave, given that rents were just due, will be eviction work. We're going to start getting the phone calls from individuals on those issues.
So most of those sound like service areas that Beau Tzedek has a certain fluency in and has historically done work in. Are you seeing those are, and definitely upticks that make sense given, what's going on? Have you seen yet, or can you imagine or anticipate, new service areas that or new areas of need that are going to emerge because of the radical changing kind of nature of life and needs and circumstances that we're seeing?
Yeah, so I would say, and while we don't practice in this area of the law, I do know that one of the fields that people are very concerned about is family law and domestic violence. Domestic violence calls sort of dipped, as did all calls, but we suspect it's one of those sad, perfect storms, right? Of there was already tension, there was already violence, and now everybody is in the home for extended periods of time. And so we suspect that there will be a spike in domestic violence cases. We suspect that there will be a spike in child custody issues. There's a lot of work going on right now. For example, the foster care court, it's called the dependency court, issued a county-wide order stating that all visits between parents and caregivers and foster children are suspended. There's a lot of questions around that. There's a lot of concerns over the inability for social workers to be present monitoring activity. And so there's a real fear that there's going to be a huge spike in the incidence of child abuse. And then there are a lot of concerns over how public benefits rules and regulations will roll out. The state has been quite good about issuing notices to the effect of, look, we're not going to terminate anybody's public benefits during this period of time. Any automatic activities that are kind of computer driven that may have caused problems in the past will be suspended. They're still taking new applications, but it's a huge bureaucracy. It's a huge system. There are going to be problems. And so we suspect that we're going to end up getting more calls from individuals whose food stamps have been cut off, their in-home supportive services have been cut off or reduced, and we're going to have to figure out ways to advocate on behalf of those clients.
Those certainly sound like significant challenges. What do you imagine to be the biggest challenge that Beau Tzedek faces kind of in this environment, trying to respond to clients' needs?
Yeah, I think it's going to be the sheer volume of the calls and the clients that come in. Just by way of example, yesterday I was on the phone with representatives from Karen Bass's, Congresswoman Karen Bass's office, and they have invited us to participate in a town hall style telephone conference. And they said, look, we would love for you guys to cover scams that are targeting seniors. And we really need help on behalf of our small businesses. So if you could cover some issues there. And they said in the past couple of weeks, they have had approximately 25,000 individuals calling in to those town hall meetings. Whereas in the past, they had approximately 2,000 to 3,000 individuals. With 25,000 individuals on a call, even if a small fraction of those individuals call us at any one time, 200, 300 individuals, that's a lot of work. It really means we're going to rely on our volunteers to a very high degree to get through all those calls. So volunteers who can take the calls, help assess what the legal issue is, and then report back to our team. I have 7 people who need help with reviewing their commercial lease. What do we do? And then the volunteer attorneys who can say, well, great, I can take 3 of those commercial lease cases. My colleague will take the other 2, and we just cover everything. Same with employment rights. I think that that'll be another big issue down the road, and just having the person power to handle those and manage people's expectations.
I think it's the down the road piece that you just said that I think, I imagine will be just very difficult. I sort of think about this sometimes as like a hurricane or some other natural disaster, right? That comes through, and it's not going to be until 6 or 8 months from now, or maybe longer, that folks are really starting to pick up the pieces of their lives and dealing with, tenants' rights issues, dealing with employment issues, dealing with, family law issues that right now they may or may not even be in the throes of, but that this sort of wave, the disease may be peaking hopefully soon, and we're trying to flatten that curve, but the peak of need in people putting their lives back together, is probably months at least.
Exactly. And even before all this hit, we had all received a report from the California State Bar that said, one of the biggest hurdles to people securing legal services is, number one, they don't realize that they have a legal problem that they're dealing with. It's a life problem for them, right? They're just trying to figure out, well, how do I pay rent? And my landlord's knocking on the door, and what do I do? And then they don't realize that there are free legal services like Beau Tzedek and other agencies. And so a lot of our work right now is just getting the message out. We are here. You may not need us at this exact moment, or we may not be your biggest priority, but we are here and we're ready to help. So we're trying our best to spread the word out amongst our community partners. That's one of the reasons why I was on the phone with Karen Bass's office, to let her know, like, hey, if your constituents are calling, remember, we are here to help. So yeah.
It's, it's such a salient point, just saying that, people they think it's a life problem, don't realize it's a legal problem. You're back to, the two of us meeting 10, 11 years ago. And I mentioned David Lash earlier. I remember at the very first, no, before the first clinic, David explaining to me as a young, I think I was a rabbi already, but young rabbi that knew nothing about the pro bono legal service world. And I asking him what I now know was sort of a foolish question about, well, why is this even an issue? And he said, you don't understand, because the world works for you most of the time the way it's supposed to. And the system works for you most of the time the way it's supposed to. He said, you don't need a lawyer in order to be able to go see the doctor. You don't need a lawyer in order to be able to open a bank account. You don't need a lawyer in order to be able to rent an apartment or rent a house. You don't need a lawyer in order to make sure that, your medical insurance pays for whatever it is. He said, but many, many people in the world do need lawyers in order to make sure that the way things are supposed to happen based on our system, in fact, do happen in that way for them. And he said, we just have the privilege of living, on in a certain corner of society where, for the most part, we can advocate for ourselves and we have the wherewithal to do it, and things generally are set up to work for us. But that's not the case for, in many cases, the majority of folks who may not even realize that they need an attorney so that the doctor will return their phone call and the insurance company will pay for the bill.
Yeah, exactly. Yeah. And in terms of need, obviously the need is going to skyrocket. Even before all of this happened, the most recent study showed that for every one legal aid attorney, there were 8,000 eligible clients, right? So it's an uphill battle, and we can only do it thanks to the support of our volunteers. So it really makes a difference.
Well, to that point of 8,000 clients for every attorney who's decided to spend their days doing pro bono legal work, thank you for devoting your life and career to this, because we all know that it would be considerably more lucrative for you to be in private practice somewhere billing who knows how many times what you can bill an hour. But as a friend of mine who's an attorney says, who's volunteered at several of our clinics, it always gives him pleasure to use his powers for good rather than for evil. So thank you for using powers for good. I want to open it up, as has become our custom, for questions. Anybody have a question? You can either send it on the chat to me or in some sense of semblance. If I can see you, I'll unmute you. There you go. We'll take one here. Yeah, Susan, Sukasa.
My question for Diego is, if one is a non-attorney, how can we volunteer and be at Tzedek? What are the opportunities there for us?
Yeah, so first of all, let me do this. I'm going to enter into the group chat my email address. So if anybody is interested in volunteering, you can email me, and I will connect you directly with our volunteer department to get you all set up. But the answer to your question is, you will be working side by side with our attorneys and our staff to connect with individuals and start them down the process of helping resolve their legal issues. So we have many non-attorney, non-paralegal volunteers who come in and they help answer phone calls. For example, someone calls and says, I need help with X, Y, and Z legal issue. What we do is we train you and we provide you with scripts to guide you along the way. For example, someone says, well, I am calling because I want to get an advanced healthcare directive in place. In the middle of this pandemic, one of the things that's most important is, let me make sure my healthcare wishes are laid out. And once you hear that, we will have trained you to, okay, now let me get my advanced healthcare directive screening tool. And I'm going to go through and ask you these 7 questions, and you secure the answers. Those get passed along to the team that handles those cases, and they will take it from there. In other instances, you may be helping put together court paperwork all remotely these days, right? You can be in your home office and helping put information in necessary portions of forms. Again, we will train you so that an individual can have their paperwork ready to have their day in court to resolve their legal issues. So it's all very client oriented, all very substantive, and I guarantee you very, very rewarding.
We've got another question. Let me unmute. Ashley?
Diego, thank you so much for all the work you're doing. Sorry, especially as a small business owner. So I've been in contact with a lot of small business owners, and I think one of the things that I haven't been aware of in order to help them is who would qualify for your services versus who should be accessing private attorneys. I honestly didn't even think of recommending. So my first question is, what are the eligibility requirements for your services? And my other question, I don't know if you guys are in the space of education law at all, but I'm curious if you're doing any work around kids who currently have no access to IEP services, or what those services are looking like right now in this space for our kind of at-risk youth in various ways.
Yeah, so to your first question, the eligibility requirements. Eligibility requirements vary from program to program at Tzedek, and they're basically defined by our various funders. I mean, the bottom line is an individual has to be low income. That is defined in a number of different ways. For example, if you're over 65 and living in Los Angeles, as long as you are frail and disabled, or a veteran living alone, monolingual Spanish speaker, or non-English fluent, you qualify for our services. For other individuals, it may depend on, in other programs, it may depend on your monthly household income. And a good rule of thumb is if someone is below federal poverty guideline levels, depending on the number of household members, then they may qualify for our services. For our small business development program, our income guidelines are vastly different. We recognize that you have to have some income, some access to capital in order to launch or maintain a business. And so what we do is we look at the business owner's eligibility. So we're looking at total number of people in the household and total household income. And we're able to go as high as 500% of federal poverty guideline levels. And if the business is also up and running, we also look at the profits and sales of the business. And there are income guidelines, numerical values for that we can go up to. And I don't remember those off the top of my head. Bottom line, if you go to our website and under our services, there's a tab or an option that says Justice for Workers. And one of the options there is our small business development program. And you'll see a link there that says, if you want to apply, click here. And there's an online application that people fill out, and they will be contacted by one of our team members to kind of initiate the process. Insofar as education, we aren't involved specifically in the education space. Except for some of the cases that we have that are guardianship matters, we do get involved in making sure that the guardian has the ability to intervene in their ward's IEP and things like that. I do know my wife happens to be another nonprofit attorney. She works at public counsel and actually supervises the education program there. So right now, a lot of the work that they are doing is more on a policy level, making sure that under COVID-19, people are still getting access to the resources that they need, that there isn't going to be an interruption, and that any interruptions do get addressed on the back end. Yeah. And there was a question on the chat box about volunteer opportunities for bilingual Spanish speakers. Yes, there are so many ways that Spanish speakers can volunteer. We have a significant percentage of our clients that are monolingual Spanish speakers, particularly out of our employment rights program. There was a mention of our family preparedness clinics. Those are clinics that we ran where we are explaining to immigrant parents how to plan for the care of their children if the parents are removed from the US. We still need volunteers to help provide that information. We have also added a component that is focused on the family charge. Sorry, oh my goodness. I'm blanking on the term, the public charge rule, sorry. This was a change in federal legislation that basically said, if the government feels that you will be a burden on the United States, they can prohibit you from ultimately securing legal permanent residency status or citizenship. And it used to be this kind of like, kind of multi-factored tests where the federal government would weigh various factors. And they changed the law such that now if you receive certain types of public benefits, you're automatically a public charge. And that has sparked fear in the community. There have been parents who have pulled children out of school-based programs like free lunches. You know, LAUSD has a free lunch program right now. Immigrant parents have not been taking advantage of those programs for fear that they will be deemed a public charge, and they don't realize that that doesn't ding them. And so we are doing a lot of presentations about that and need volunteers to do one-on-one consultations with families on those topics. The other question that I see here is, I'm guessing that you don't have to be a member of the Temple community. Is volunteering open to everyone? Yes. We accept everyone. All volunteers are welcome.
Diego, thank you so much for being generous with your time this morning. I know, I'm sure like many of us, the whole working from home thing has resulted us being busier than ever, just in different ways. And I know how precious your time is. And thank you for sharing some of it with us this morning. And again, for the amazing work you do and Beit Tzedek does. And most importantly, a genuine mazel tov and congratulations on your, I guess promotion is the right word. And we'll get that lunch eventually. Diego and I had a lunch on the books that unfortunately, you know, every restaurant is closed. So got kicked down the road a little bit. Thank you all for joining us. Just a quick kicker for next week. Next week, we'll continue our series of conversations with Michelle Prince. Michelle is the executive director of Our House Grief Support Services, and has always done a lot of really, really amazing and powerful work, and is continuing to through in the mental health space through this crisis as well. So we'll be back next week at 11. Tell your friends, please join us. And Diego, looking forward to seeing you soon.
Thank you, everyone. Really
happy Passover, everyone. Chag Sameach.